It's been nearly a month since the Easter long weekend, when there were real concerns the holidays could spark a dreaded third wave of COVID-19 infections. Numbers have remained fairly low, but it doesn't mean there won't be another wave of COVID-19. One of the groups monitoring the situation in the country is the international organisation Doctors Without Borders, or Médecins Sans Frontières, which has health workers based here. Their doctors and nurses worked in field hospitals and alongside our health workers during the first and second waves of COVID-19. And to tell us more, I'm joined by Dr Rachel Tullet, coordinator of MSF's COVID-19 response in the country. Doctor, thank you so much for your time. You know, we know how devastating the second wave was here in South Africa, and we have been told by doctors it's not if there'll be a third wave, it is simply when. So I'm wondering if you're getting an understanding of when that third wave will hit South Africa and whether there's a chance it could be even worse than our second wave.
Absolutely. And, you know, we do share your concerns about an imminent third wave. Unfortunately, I can't give you any more information about when that could be or how big the wave could be. But I think we've all been very concerned by the situation around the world this week, especially in India. And that is an important reminder for us to remain vigilant, to keep monitoring our data and to look to catch any increase early. And even on a day-to-day basis, you know, we're still seeing quite high levels of cases, even though it's remaining relatively stable. The numbers hovering around between 1,000 and 1,500 cases a day. So no, we are really correct to remain vigilant.
Yeah, and we mustn't forget that every day in South Africa, people are still succumbing to this virus. It has not gone away. And yes, absolutely, what's happening in India is a very sobering reminder that there's still some way to go. It's a very interesting document that MSF has put together about the big learnings from working through the first and second wave here in South Africa. You know, and you highlight things that I suppose one could have guessed at, such as, you know, nurses need to be supported. There needs to be better training. There needs to be senior supervision. We need to make sure we've got enough oxygen. But one of the issues in this document that really was quite distressing was the issue of preventable deaths, that people didn't need to die. People who died because nasal prongs and masks slipped out of place overnight. They didn't get the oxygen they needed, and that's the reason they died. Talk us through those scenarios, where they happened, how they happened, and how we can stop them again.
Yes, and preventable deaths have really been a huge source of concern to us, and our staff working during this last year have noticed many incidences where we really felt that care could be improved. And that's not to say anybody's at fault. We know how difficult it is to work when there's so many patients. Wards become so busy and staff are really overloaded with tasks to do. But examples that we did see, unfortunately, for example, was when oxygen supplies became disconnected, or if a patient did not have any assistance to get up to use the bathroom, and they did so alone. You know, there's a real risk that when oxygen is removed suddenly, a patient's oxygen levels can drop, and that can have really serious consequences, and patients can even die from that. So really, one of our major reflections from our interventions over the past year is really the importance of making sure that we do focus on all the basics of patient care and do what we can to really increase the number of eyes we have on patients. And one way we have been doing that is by employing extra healthcare workers to support with these basic tasks. But no, it does remain a huge area of concern.
And of course, when we look at what's happening in India, I mean, there are literally physical fights over oxygen supply. We know that the world is rushing to help India, and hopefully that will alleviate the situation. But here in South Africa, where are we with our oxygen supply? Should a third wave hit, let's say in the winter months, will we have enough oxygen?
You know, that's been one of the positive changes that we have seen over the past year. I mean, it's hard to believe it was just over a year and a half ago that this all started, and the volumes of oxygen needed for our patients really took people by surprise, and especially when you get those really rapid increases in caseloads in the hospitals. Certainly there has been a huge improvement in the availability of piped oxygen to hospitals in South Africa, and that's so important to help ensure a consistent supply. And there are many advantages of piped oxygen over other methods, such as having oxygen cylinders. However, again, it's important to remain vigilant and to ensure that all stocks and supplies are well maintained, and that we do keep a careful eye on this, because we know how vital it is to have all patient beds equipped with oxygen.